Welcome to today's Eye Health Spotlight, where we're diving into a specific type of cataract, the blue dot cataract. Often discovered incidentally during routine eye exams, these unique opacities in the lens can be intriguing and sometimes concerning. In this video, we'll explore everything you need to know about blue dot cataracts, from their causes to diagnosis, treatment, and what to expect. So, what exactly causes these distinct blue dot cataracts? The precise etiology is still under investigation, but it's generally understood that they represent early developmental changes within the lens of the eye. These opacities are congenital, meaning they are present at birth or develop very early in life. Genetic factors likely play a significant role, although environmental influences during fetal development might also contribute. It's important to note that unlike age-related cataracts, blue dot cataracts aren't typically associated with aging, sun exposure, or other common cataract risk factors. However, certain systemic diseases and syndromes may be associated with them. To understand blue dot cataracts, let's briefly review lens physiology. The lens responsible for focusing light onto the retina is composed of specialized lens fibers arranged in a precise manner. In blue dot cataracts, localized disruptions occur within these lens fibers, leading to the formation of small, blue-tinged opacities. These opacities scatter light, which is what gives them their characteristic appearance under examination. The precise molecular mechanisms underlying this disruption remain a topic of ongoing research, but it's believed to involve irregularities in protein synthesis or cellular organization within the developing lens. Estimating the exact prevalence of blue dot cataracts is challenging, as many individuals remain asymptomatic and undiagnosed. They are more commonly identified in younger individuals undergoing eye exams for other reasons. While specific epidemiological data is limited, it's understood that blue dot cataracts are a relatively rare form of congenital cataract, considerably less prevalent than age-related or other secondary types of cataracts. Because they're often asymptomatic, the true number of cases is likely higher than what's reported. One of the most notable characteristics of blue dot cataracts is that they are often asymptomatic. Many people with blue dot cataracts are unaware of their presence. However, depending on the size, number, and location of the opacities, some individuals may experience mild visual disturbances. These could include glare, especially in bright light, slightly blurred vision, or difficulty seeing at night. In most cases, the visual impact is minimal and does not significantly interfere with daily activities. It's crucial to remember that the severity of symptoms can vary greatly from person to person. Diagnosis of blue dot cataracts is typically made during a comprehensive eye examination. The ophthalmologist will use a slit lamp, a specialized microscope with a bright light, to carefully examine the lens. The blue dot cataracts appear as small, distinct, bluish or grayish, white opacities within the lens. The examination will also assess the overall health of the eye and rule out other potential causes of visual disturbances. In children, a dilated eye exam is often performed to allow for a thorough evaluation of the lens and retina. While a general classification of cataracts can be done based on locations, nuclear, cortical, subcapsular, blue dot cataracts are inherently classified by their distinct appearance. They fall under the umbrella of congenital cataracts, specifically characterized by the presence of these unique blue or bluish-white spots. They aren't subdivided further based on their specific morphology or location, as the blue dot nature is the defining characteristic. In many cases, no specific treatment is required for blue dot cataracts. If the cataracts are small and do not significantly affect vision, the ophthalmologist will typically recommend monitoring with regular eye exams. If the cataracts are causing significant visual impairment that interferes with daily life, cataract surgery may be considered. This involves removing the natural lens and replacing it with an artificial intraocular lens, IOL. The decision to proceed with surgery is highly individualized and based on the patient's visual needs and overall eye health. Because blue dot cataracts are often congenital and linked to genetic factors, primary prevention is not typically possible. However, maintaining good overall health during pregnancy, avoiding known teratogens, substances that can cause birth defects, and ensuring adequate prenatal care can minimize the risk of various congenital conditions, though their effect on blue dot cataracts specifically is not well established. Genetic counseling may be considered for families with a strong history of congenital cataracts. The prognosis for individuals with blue dot cataracts is generally very good. In many cases, the cataracts remain small and stable throughout life, causing no significant visual problems. If cataract surgery is necessary, it is typically a safe and effective procedure that can restore clear vision. Research into the genetics and molecular mechanisms of congenital cataracts, including blue dot cataracts, is ongoing. This research may lead to future advancements in diagnosis, treatment, and potentially even preventative strategies for these conditions. Improved understanding of lens development could also lead to novel therapies.